Hello, I'm Rose Maljanian, Chairman and CEO of Health Cause and Chairman of the Board Emeritus for the Population Health Alliance. I'm joined today by Beth Donahue, CEO of the Better Medicare Alliance, giving you a glimpse of what we'll cover at PHA's Annual Innovation Summit, October 25th and 26th in Washington, D.C. Beth, with now over 50% of seniors in Medicare Advantage plans and the vast majority of seniors saying they prefer care at home when possible, what are the top challenges seniors are struggling with related to their health care?
Thank you so much for having me in this conversation, Rose, and so greatly appreciate the partnership that we have with PHA. And unfortunately, often when we're talking about seniors' healthcare, we do need to start with what some of the challenges are. So I'll highlight a few that we focus on, but what does give me comfort is that in Medicare Advantage, where we're serving over 31 million Medicare Advantage beneficiaries, providing access to care and affordability, with some of these challenges, we're seeing that there are areas where seniors' needs are being met through Medicare Advantage. But I think when we sort of really start with some of the unique challenges that put the seniors at greater risk is food insecurity. As you know, and your members know, seniors live on fixed incomes, leaving them to just really impossible choices of choosing between buying food, or if they're going to be paying medicine, having to resort their resources to medicine. But at the same time, for those seniors who are in Medicare Advantage, and one of the areas they really value by being in Medicare Advantage are the supplemental benefits. And so we in Medicare Advantage do what we can to meet seniors' nutritional needs. So when we look at that challenge of just food insecurity, that does give comfort. And then the other is, and again, I know you hear about this, is seniors struggling with loneliness. Just in 2023, 1 in 3 older adults were reported to be finding feelings of isolation just in the past year. And so we really want to focus on that area of concern, because obviously that leads to mental health issues and heightened mortality rates. And again, when we look at seniors who are in Medicare Advantage, one of the areas where we address in loneliness is the benefits of being able to have in-home care, where people are coming into their home, providing them care, both health benefits, but there's social benefits with that as well. And then also in Medicare Advantage, providing transportation for seniors to get to appointments and physical fitness programs. And so that also does address the loneliness. But I would highlight those 2 areas as far as challenges, and obviously focusing on the rising cost of healthcare.
Couldn't agree more. And I always say, when people think twice about investing in basic things like food insecurity and loneliness, think about the offsets when you're talking about major complications of chronic disease or even accelerated dementia facility care that we all want to avoid. So kudos to all that are addressing those issues. We are seeing new investments in startups dedicated to seniors and broader use of technology to monitor seniors remotely and increase touch points. A very recent example, just this summer, Author Health raised $115 million in capital for a digital mental health program targeting specifically the Medicare Advantage population. What are you seeing, if you could provide a couple of examples of strategies that the Medicare Advantage plans are deploying to address the needs of seniors, especially digital health?
And I appreciate you highlighting digital health and just frankly anything in the home health space. And so I'll highlight some other innovative Medicare Advantage strategies. And one which I'll be speaking on in another venue is just the focus of shifting from acute care to value-based care. And we're hearing a lot of that prioritization and also from the leadership in the Biden administration of the focus on value-based care. And the reason that we're seeing the value of that to seniors in Medicare Advantage is that it's focusing on the whole person, and it's focusing on preventive care, early intervention, and better coordinated care. And so it means that we're just not looking at one aspect of the patient, but looking at the whole patient, and really just taking a whole fresh look of what care looks like as providers are serving those patients and patients as well. And then, the other innovative area that we find, and again, it's a priority for all, but especially in Medicare Advantage, and a key tenet of the MA program, is advancing health equity for seniors. And right now, we're finding nearly 100% of Medicare Advantage plans are offering some high quality supplemental benefit that traditional Medicare is not offering right now, that focuses on reducing disparities and offering that comprehensive care that, again, is a quality of value-based care. And so this ultimately leads to one of the benefits of MA and affordability, because by focusing on reducing the disparities and offering comprehensive care, it means that plans can offer a wide range of benefits to enrollees for lower costs. And that's whether or not it's vision or dental benefits, but everything, all those benefits being geared towards holistic health. So again, treating the whole patient, which I know a lot of our partners and PHA prioritizes.
It's all about the consumer at the end of the day, and meeting their needs, no matter if you're a provider or a health plan. And the emphasis on health equity, just so important. And folks, that as you look at your data, please don't look at averages. Do those subset analysis to make sure you're not leaving anyone behind. So that's really great. And we just want to give a glimpse. We don't want to give you our whole in-depth talk here, but just a couple 30-second answers as we think about what's next in the field of senior health. What's the biggest headwind challenging innovation in the senior care space?
I think it's focusing on the excitement around telehealth. And we saw the reality, the benefit of telehealth during the pandemic. And sadly, we had that as the reason why it came to the forefront. But I think there's just a lot of excitement around the convenience and the accessibility that telehealth brings to seniors, particularly those in underserved communities. So it both has health benefits, but also, social benefits, as I mentioned earlier. And then I think, again, when we talk about telehealth, it's also about home health and being able to have healthcare professionals going into the home and meeting the needs of the patient on why they're there, but then being able to see the other needs that need to be met by that senior, which may not have to do with their own health benefits. It may be other areas of concern, construction in the home, and how that could cause injuries to seniors. And so just being able to be in the home of seniors and being able to serve them in a holistic way and going beyond the health benefit of it as well.
There's so many environmental things that can be fixed in the homes for seniors. There's a whole lot of folks living marginally in the community that when you are able to get in there, some great fixes. And on your point in telehealth, this is where our groups can band collectively together to really promote the telehealth as a access point for seniors that we don't want to lose as we recover from COVID. So banding together to advocate for removing barriers, whether it's across state lines, type of provider, licensure, we'll all be working on that, no doubt, aggressively for the years to come. So now on the tailwind side, what can innovative organizations take advantage of to create change?
There is a growing, population of seniors. Seniors are aging. And so as they age, what do we need to be doing to meet those needs? And also as diverse communities are continually growing, how are we ensuring that we're being able to provide access to care for those low income and seniors in diverse communities? And we have been able to see a lot of dependence on Medicare Advantage by those low income and individuals from various communities of color. And it's why that there are more seniors who choose Medicare Advantage, who are older, more medically complex, low income, and from diverse communities than those who choose Medicare, the fee for service. And as I talk about the work that we do here at BMA, it's advocacy and research. And we've been pleased to see so much research of late that highlights the low income and diverse communities who are relying on Medicare Advantage. And just recently, Harvard Medical School and Inovalon had partnered on demographics of those in MA and showing that there were those who were depending on Medicare Advantage, who were from various communities of color and were investing and choosing MA over fee for service, as well as ATI Advisory, who had done research recently finding that Latino, Black, and Asian Medicare beneficiaries were significantly more likely to enter into Medicare Advantage. So when we do a look ahead, we want to look to see that we're continuing to provide access to that increasing population and meeting their needs, and also showing the affordability that MA brings, because on average, seniors save over $2,400 in out-of-pocket costs by being in Medicare Advantage.
A point that you raise that's important across all populations is when it comes to Medicare, seniors have choice, whether that's between traditional Medicare or Medicare Advantage or among Medicare Advantage plans. So there's a lot of focus on being competitively meeting their needs. And, the three things that always pop up is the zero premium plans, more access in communities, multiple plans, multiple choices in communities. And then, of course, what you mentioned, that simplicity of bundling benefits so they're not buying individually and doing so more affordably with vision and hearing and dental being part of some of these packages. So that simplicity being a great advantage. Well, that's what we'll share with you so far. Thank you, Mary Beth, for being here. And to all of you, please join us for a more in-depth discussion on senior health trends at the Population Health Innovation Summit, October 25th and 26th in Washington, D.C. See you there. Thank you.
Thank you, Rose. Thanks, PHA.
Looking for more answers in population health? Be sure to attend PHA's Innovation Summit, October 25th and 26th at Top of the Hill in Washington, D.C. Learn more and register today at populationhealthalliance.org.